Hello dear friends, hope you are studying well for your NEET and next exams. In this changing pattern of NEET to next, we have to try to integrate our discussion and subject understanding in this way so we can solve our clinical questions with easy and smart way in one go. So how you can solve clinical questions? So today we are going to discuss some of the basic science to integrate with specialty subjects, and we will give you idea about how to solve clinical questions with simple way. So in this video, me and my friend Meet Patel will discuss the today's topic integration discussion of microbiology and pharmacology. And in this changing pattern, we have to learn about how to integrate one subject to another, because the next exam will consist of one of the clinical question will long question. So you have to make your strong basics and apply your knowledge to a particular clinical question so you can get best out of it. So let's start our discussion. So in this today's topic, we have the fungal cell wall microbiology discussion with antifungal drugs mechanism of actions, and at the end of the video I will be discussing integrated clinical questions and will give you idea how to solve clinical question and reach to the diagnosis. So let's discuss the fungal cell wall membrane.
Okay, so basically you have studied fungal cell wall in the second prof in microbiology. So let's revise it. What is fungal cell wall? The fungal cell wall consists of main four components. The first one is proteins, the second one is beta glucans, the third is chitin, and fourth one is cell membrane. The cell membrane, which consists of ergosterol, which is the main component of the fungal cell wall, which binds together all the components and strengthens it so that the antifungal drugs can't act on it. So let's study the conversion of ergosterol. So first component is squalene. The squalene is converted into squalene epoxide by the enzyme called squalene epoxidase. The squalene epoxide is converted into ergosterol by the enzyme 14-alpha demethylase. The final product ergosterol is the main culprit of all the fungal cell wall. So this is the basics of fungal cell wall. Now we have to study the antifungal drugs and its mechanism of action. And there are also side effects we will learn in afterwards. Okay. So let's understand the basics of antifungal drugs and their mechanism of action. So there are many drugs used as the antifungal. The first one is terbinafine. The terbinafine inhibits the conversion of squalene to squalene epoxide. It is the group of allyl amine drug which is used in the superficial infection, candidiasis, histoplasmosis, etc. The second one is the most commonly used drugs called azole, which inhibit the conversion of lanosterol to ergosterol. So the ergosterol is not formed and the cell wall will die because of the degradation of the components. The third group of drug is amphotericin B. Is the type of antibiotic in which there is the formation of micropore from which all the components of fungal cell wall will come out and finally the cell wall will degrade. The fourth group is echinocandins, which inhibit the enzyme beta glucan synthesis, and the fifth drug is flucytosine. So this is the basic drugs which are used in day-to-day life. The most common is azole. You have to remember the azoles are useful in the superficial infections like dermatophytosis, the tinea, the candidiasis, tinea cruris, tinea corporis, etc. All the infection. Let's learn about the side effects. So the overall side effects of the antifungal drugs, which are the most common, which you will see in day-to-day life, is nausea, vomiting, chills, headache, local irritation, rashes, and joint pain. There are some specific side effects which you have to study for the next exam. For example, let's talk about ketoconazole. The ketoconazole has the specific side effect of gynecomastia, loss of libido, and oligozoospermia. Now we have to study other drug which is most important. It is amphotericin B. The most important side effect of amphotericin B is nephrotoxicity. So we have to check the renal function test before giving the drugs to this patient. The other side effect of amphotericin B is anemia, CNS toxicity, acidosis, and hypokalemia. So these are the common side effects and the specific side effects of some drugs. So now let's hand it over the clinical case discussion to Vidit. He will further assess you to the same.
So as you know the basics of fungal cell wall and you have got the idea about the antifungal drugs. So let me take you the clinical case discussion, and I will tell you the how to solve particular clinical case discussion on this discussion part. So we have make the clinical question in that way. So before giving you answer, please type your answer in the comment box and try your knowledge and application your knowledge. So this is the clinical questions. So let me read it for you, and I will be discussing one of the rule out option, and I will be end of the discussion, I will tell the particular answer why this is the correct and this is not correct. So one of the patient, 37-year-old woman come with the AIDS, has been recently diagnosed with systemic candidiasis due to Candidiasis cruris. And one of the physician is treated with the antifungal drugs, and 4 days later the patient is coming with this below features, and urine analysis suggestive of this: serum creatinine, which is the increase, and blood urea level, which is also increased from its normal range, plasma potassium decrease from its normal range. So urine analysis suggests there is the one drug acting on the renal and damages the renal function. So which of the following drugs, which is the most likely prescribed in this patient? So let's try to find out the keywords from these questions and reach to the diagnosis and find out the which is the most likely drugs for this patient. So as you know, in the clinical question mentioned was the patient diagnosed with AIDS, which is the immunocompromised state. So immunocompromised state, and patient develops the opportunity infections from the candida. Okay, so with the candida we need to cover with the strong drug that prevents the patient complaint and treat the disease accordingly. In this case, if we are treating with the small superficial drug which not affect in this patient, and we will come with the resistance case. So you have to take your strong drugs and treat with accordingly. So you need to have strong drug to prevent this infection. So in this case, you are going to get the prescribed like AIDS immunocompromised state, and you are getting the candidiasis infection, which is the opportunities infection. So what is the options for this question? One is the amphotericin B, flucytosine, terbinafine, flucytosine, fluconazole, or griseofulvin. Which of the answer is the correct in this patient? As the myth has told you about the antifungal drug and its mechanism, so you have got idea. Type your answer in the comment box and check your knowledge on the basics. So let me take you the rule out criteria for these above options. Why C answer is not correct? C answer terbinafine is not correct because terbinafine is most commonly used in ringworm like superficial infections. This is the opportunistic infection which will not help by this drug. So answer C is wrong. Answer is griseofulvin, which is also antifungal drug, which is not used in this case because the griseofulvin also used for superficial infection like scalp, nail and toes, and athlete foot like infections. And its side effects like rashes, numbness and tingling in your hands and feet. So this answer is also ruled out for this question. We have D answer is also incorrect because flucytosine is the medication which is not used nowadays and which is rarely correcting the disease like opportunistic infection. So we are remaining with B and option. Why B answer is not correct? Because fluconazole also used the patient with superficial like ringworm, tinea, candidiasis, which is not associated with opportunistic and immunocompromised state. So fluconazole is not useful in this case. So correct answer for this patient is amphotericin B, because already myth has discussed the side effect of already discussing antifungal drugs and its side effect. The amphotericin B causes the nephrotoxicity, acidosis, hypokalemia and anemia. In this patient, already clinical question is given the some of the urine analysis which is suggesting of renal insufficiency, urine creatinine, plasma urea decrease in the patient. So we have to rule out the renal insufficiency and which drug is causing the side effect for this patient. So drug of choice for most systemic mycosis and serious dose dependent side effect causing by the amphotericin B. So we have to check renal functions before giving to the patient of this opportunistic infection for candidiasis, because the amphotericin B causes the renal dysfunction due to disturbance of renal tubules, azotemia and renal tubular acidosis, and potassium wasting as causing the hypokalemia, and most prominent symptoms by this anemia and hypokalemia. So you have to know this topic in simple and smart way, and we have tried to integrate this topic with basic microbiology, fungal cell wall, with pharmacology discussion of antifungal drugs, and with give you the approach how you can solve clinical questions with your basic science, and you can reach to the particular answer without worry. So hope you have understood the topic and you have get the idea about the antifungal drugs and its mechanism. So thank you so much, guys, and keep learning. Hope you have no queries. If you have any queries, please feel free to type in the comment box. We will meet you in the next video. Thank you.
Thank you.